Welcome to Megabucks Radio. Conversations with successful entrepreneurs, sharing their tips and strategies for success. Real-world ideas that can put megabucks in your bank account. Here's your host, Nina Hirschberger.
Hello and welcome to this episode of Megabucks Radio. This is Nina Hirschberger, your authority positioning coach, and I am so excited. This is going to be a little unusual. Today I have with me Dr. Ken Vinton. He's a doctor of chiropractic practicing out of Pennsylvania, but he has a revolutionary approach to pain and wellness. So Dr. Vinton, welcome to today's show.
Thank you. Glad to be here.
You know, let's start out. I mean, I was reading a little bit of background about you, and it seems like at the age of 14, there was something that happened in your life that really put you on the path to becoming a doctor of chiropractic. Tell us a minute about that.
Oh, for sure. So it turns out it was actually a weightlifting injury. We didn't know it at the time. We just knew that I was lightheaded and had very cloudy, or what they call foggy thinking. I just couldn't think straight. And I was dizzy and lethargic. I just laid around a lot. And so my parents took me to Children's Hospital in Pittsburgh, one of the top hospitals in the country. They ran almost $13,000 in tests. They did CAT scans. They did testing on my hearing and on my vision. Long story short, I remember the day we walked into the doctor's office, and I was dizzy. I remember having to hold on to the building as we walked down the sidewalk. I had to keep my hand on the building because everything was just spinning. And I remember the doctor didn't even take us into a treatment room. He just met us in the hallway, and they were old fluorescent lights, and he held an old dark wood paneling back then, but he held up the x-ray, and he told my mother, "We found what we think is the cause of the problem. Your son has large sinuses." And they gave me a drug called Antivert, which made me very sick, and so I quit taking that. So after $13,000 in testing, they had no answer, and so my mother snuck me off to her sister's chiropractor. He identified the problem, and in the first treatment, the dizzy spells were getting better. The second treatment, they were gone. And I said, I knew at that point I always wanted to help people, but now I knew the vehicle through which I was going to do that. So I went through accelerated programs in high school, accelerated programs in my undergraduate, and I graduated with my doctorate degree a year early. So I was still 22 years of age, and I had my first clinic. And it's been a wonderful, wonderful, wonderful journey since then.
Well, I don't think your education stopped there. It seems like, I've been to a lot of doctors of chiropractic, and there's a certain methodology. You go in and they do this and they do that, but you didn't stop. You kept going with that education and that training. Tell us what happened then.
Well, I'm a lifelong learner. So the first thing is, and this is embarrassing, there's actually a study that was done by a student in Los Angeles. He went to the 10 largest clinics in Los Angeles, and he just wrote down what they did, just to see what makes these doctors successful or not, and who got results or not. And the unfortunate part was they all did the same thing. He actually named the article The Flying Seven, which means all those chiropractors on every patient, on every visit, did the same thing. They crack the neck left, then they cracked it right. Then they crunch, crunch, crunch down between your shoulder blades, get on your side, they pop your hip left, then they pop your hip right, which I actually had the great pleasure of. I was on my way to University of Pittsburgh. I took a shortcut to avoid traffic, and I got lost. My turnaround point was this huge clinic that said We Care Chiropractic Clinic and Research Center. It took up a half a city block. It was a 25,000 square foot building. I went inside to get directions on how to get unlost, and the doctor was walking down the hallway. He says, "How can I help you?" I said, "I'm looking for my way back to the university." He asked what I was studying. I told him I was studying to be a chiropractor. He goes, "Well, this is a chiropractic clinic." He goes, "I'm having a seminar here in 2 weeks. I'd like to see you there in the front row." So 2 weeks later, I went to that seminar, and he changed my life. He was one of the top leaders leaders in the field. He had a very specific methodology. He had a research center. He said, look, I'm going to be at the Palmer College in a few weeks. I'd like to see you out there. So I flew out to Iowa, met him at Palmer, fell in love, and started classes 8 weeks later.
Wow.
But from that day till this, I've never stopped studying. So I read about an hour to an hour and a half a day on topics relating to health. Both standard health things that you might see in the news or from your family doctor, cutting-edge medical things like stem cells, but also alternative things. You know, that most people don't know that medicine became what it is today at the early turn of the 1900s. That's when Rockefeller agreed to tell the government that he would standardize medical education. And at that time, basically, that meant if you didn't teach and push his drugs, you lost your federal funding. Half of all medical schools closed within 6 years. Things like homeopathy, naturopathy, osteopathy all went by the wayside. And the end result was they also passed a law at that time that says the only thing that can treat or cure are drugs and surgery. Now, that's absolutely not true. I mean, we look at things like diabetes nowadays. Diabetes type 2 is 100% foodborne. That means what you're eating. And if you change what you're eating, nearly 100% of the time, you'll reverse that. So their version is just keep pumping full of drugs. The trouble is your sugar numbers keep getting higher. So then you move from the pills to the shots to the insulin. And the trouble is you never fix the underlying problem, and you have all the ravaging side effects. So I think that's, in my opinion, criminal. That's actually malpractice to not discuss the 4 things that keep us alive and make us healthy. And those 4 things are food, right? I mean, there's quality and quantitative. So if you have no food, at some point you'll die. You have really terrible food, at some point you'll get sick. If you have tremendously good, healthy, whole foods, fruits, and vegetables, you'll have more abundant wellness. The same thing is true of water. If you drink no water, at some point you'll die. If you have little water, you'll have dehydration effects and other health issues. If you have toxic water, like you went to Mexico and drank the water, right, you might get a tummy ache. But if you drink clean, fresh, healthy water, then your cells would be liquefied and hydrated and function the way they're supposed to function. The same thing is true of oxygen, right? If you lived in a home that's smoked or near a factory with, like Pittsburgh used to be where I grew up, you know, they used to have the gray clouds sitting over the city from all the steel mills. So if you have no oxygen, in short order, you'll die. If you have polluted oxygen, in short order, you'll be sick. But if you have tremendously good, clean, healthy air and oxygen, then your body will be vibrantly well. Well, those 3 things are our lifestyle. But that 4th essential, right? The 4th essential is the mental impulse. It's the impulse from your brain down over your spinal cord, out over your nerves that control every cell, tissue, and organ in your body. And of all the health specialty, there's only one, and that's the doctor of chiropractic, that even remotely aims to remove any interference between the brain and the body by the way of the nervous system to keep things functioning normally, as well as to coach you on those other 3 essentials. So as we've gone through the years, any time that we've come across an issue that we couldn't solve, we study the 4 corners of the earth to find out what is the best ways to solve that, and we incorporated that into our clinic. So as we sit here right now, we are one of the finest equipped clinics in the country, and the array of services we offer are far, far beyond what the average, whether you're a primary care physician or the average doctor of chiropractic might offer. I mean, we have neurologists on staff, we have medical physicians on staff, we have doctors of chiropractic on staff, we have everything from stem cells to very, very specific forms of adjustments and alignments to we have other devices like class 4 lasers and neurofeedback. So we kind of cover the spectrum, and there's very little within the human body that we do not have an extremely effective and proven way to help improve the functioning of that part of the body to help your body to regain its health. And something we're very, very proud of. We put a lot of time, a lot of study, and a lot of financing into producing one of the top clinics in the country.
Okay, so I know you've got a particular methodologies you've done, but so I'm a new patient. Walk me through. I call your office and I say, I've heard really amazing things about you. I'm going to go to me. I said, my hip hurts. Well, you know, what happens next?
So the first thing we do, and we actually trademarked it, it's called the Vinton method, and it's just a culmination of a bunch of different exams, but literally doesn't matter whether it's your hip, your big toe, or a headache. We do a full body exam from the very top of your head all the way to the soles of your feet on every single patient, because we're looking for where the interference is, and we already know what hurts, and we just trace that back to the point of interference. So for a hip, is it something in your neck that might be out of alignment, throwing your posture? So we have bilateral weight scales. Not uncommon to see somebody carry 50 more pounds on, let's say, the right-hand side than the left-hand side. Well, over time, that imbalance in posture, which can also come from a dropped arch, it can come from something wrong in the back, it can come from something wrong in the neck, but that can wear a joint away. So we need to determine that first. Second thing, we're going to do an exam and find out if any of the nerves from your neck or your lower back that go down your spine into your hip are interfered with, especially number L4 and L5. They come right through the hip on the way down to the leg. It'll often feel like you have hip pain or knee pain when in fact it's stenosis or a pinched nerve or a herniated disc in the lower back. Now, it could also be a very damaged hip as well. It could be a dropped arch in the foot contributing to all of that. So we look at all of those factors, but that's how we get such a high success rate, because let's assume you have a dropped arch. Well, that's a simple enough thing. A pair of foot levelers balances that out, straightens out your gait and your posture. Let's assume that it's the very badly degenerated hip. We could use stem cell therapy to inject into that hip and help that hip to regenerate itself like it was 15 or 20 years ago, right? So not only do you get the pain relief, but the joint itself actually heals. Now, you won't be like you're 20 years old again, but you clearly will peel 15 or 20 years off the damage that was done. Now, whatever beat your hip, it might have also beat your lower back. So we have probably a half a dozen different ways, from neurospinal alignments to a device called the VAX-D, which can decompress those discs and take pressure off any nerves or degenerated discs that exist. We can also use stem cells in the back. We can use something called pulsed electromagnetic field therapy to just reduce inflammation in the back or the hip or wherever. We could use a class 4 laser in conjunction with stem cells or VAX-D to, again, help reduce inflammation, help promote healing. So the first thing that we do is a full body exam, and we tie all the pieces together, get x-rays if necessary. If you flunk those, we'll get an MRI. And then once we have the data and know what the cause of it is, then we can best determine what the solution is. And again, whether it's an alignment, whether it's a orthotic for your foot, whether it's taking care of the back, whether it's a stem cell injection directly into the hip, or a combination of those to bring your body back into balance and help it to heal. We can't forget what we just talked about, food, water, and oxygen. Those who are diabetic, those who tend to eat the standard American diet have more inflammation, and inflammation wears away and eats your cartilage in your joints, can increase pain. So we might make some gentle suggestions about eating a little more whole food and plant-based, drinking some clean water or getting some mild exercise to help your body to heal. So again, from a new patient standpoint, by looking from the top of the head all the way to the bottom of the feet, we can find the deficits. Once we know the level of deficit, is it a mild thing? Is it a fairly advanced and arthritic thing? We would then know which of the multiples of treatment options that we have would suit your case the best to get you the maximum result for the longest period of time, so that you can get back to doing the things that matter most.
You said a few minutes ago that they went and they looked at different ones, 7 of them, I think, and they were all doing the exact same thing. I don't think this is normal for a doctor of chiropractic to have all of those modalities or methodologies or that complete workup.
You're correct. And like I said, that's why, we're one of the top clinics in the country. I mean, there's several millions of dollars worth of equipment in our office. The average family, we had a physician in recently for one of our trainings. He was an anesthesiologist and interventional pain doctor from Washington, D.C. And as you walked around our clinic here, our hospital doesn't even have some of this equipment. I mean, it's very high tech. It's very high end. but that's how we're able. So anytime I thought I really wish, or there's something I need, we went and got it. And so as a result, it's not like you can, because we're in the country. So our average patient drives 1 to 2 hours to get here, right? So that's not an uncommon thing. But some may think, well, I don't want to make the drive. I'll just go see doctor or whatever down the street. Trouble is, he's going to give you the standard things, right? Some pills or shots, which can never fix your problem. Even if they medicate you or numb you for a short period of time, the problem sits there and festers and usually gets worse. Well, definitely gets worse with time. That's what degenerative conditions do. And so therefore, the reason people come here is because it's amazing. I mean, doctors salivate when they come in the door. I mean, it's for a tech geek, we have every piece of equipment that you can imagine. And so there's very little that we can't do here on site. And as a result, we're able to take on more challenging cases. We're able to help people get a greater response. And we're able to help a more variety of conditions because we have such a big toolbox from which to draw from to help us not only in our diagnosing, but also in the treatment once we find what we're looking for. And the big difference is we're not just treating symptoms. That's what medication does. We're actually getting to the root cause. And by helping correct the cause, you get not only relief, but you get restored function, and you get more life out of your years and years out of your life.
And pain-free? I mean, do you have stories about people that actually, you really help the pain go away? Because I think that's why most people go to.
This morning, we had a gentleman who met us at the door on all fours. He was actually a patient several years ago. This morning, I think he started his tractor or something. I'm not sure what he did, but he was on all fours. And within 15 minutes of being in the clinic, he stood up. He was walking around. He said the pain was over 90% gone in just that one treatment, and it was just a neurospinal alignment. Conversely, we have people who have very degenerated, damaged knees, and after their first injection of whether it's PRP or stem cells or a treatment with the shockwave therapy, their pain is so much better. They're able to climb stairs. They're able to kneel down, get up out of chairs more comfortably. Herniated discs all day long. We've done millions and millions of treatments for herniated discs. And so people who just, one gentleman was going to sell his Harley, and he was scheduled for surgery the very next day. His wife talked him into coming in. And during his very first treatment, he said, I don't know what you're doing, but the pain in my leg is going away. And we were using the VAX-D, which is a disc decompression. And bottom line was he had enough relief, that one treatment, that he canceled the surgery. And after 2 or 3 more treatments, he took the for sale sign off his Harley. He said, I think I'll be able to ride it again. And by the time we finished the program, he was riding his motorcycle to the clinic. And it has been years since we've seen him. I talked to the gentleman he worked with the other day. He's still doing fantastic. So we have dozens and dozens and dozens of stories like that. That's actually the case for well over 90% of the people that we treat, even though they have had their problem for an average of 44 months before they saw us, even though they've seen an average of 4 different physicians or surgeons before they saw us. We're able to produce that level of result because our thorough examination, we leave no stone unturned. It's like getting an executive exam over the Cleveland Clinic. It's very thorough. And then we have all the tools necessary. Unlike the guy who does the Flying 7, his chance of solving a case is very, very low. But our specificity and the ability to be able to specifically treat what we need to take care of, our results are just through the roof.
And so that's it. When you call it the Vinton method, and you've even trademarked that name, it means that whole examination, top to bottom, and then the treatment methodology. Am I describing that properly?
Yes. So we called it we had it trademarked because it's a culmination of multiple different things we've done or learned over the last 3 decades. But in an essence, what it is, exactly what you just said, it's the full body exam. And we often pick up things that people didn't know they had wrong, right? So they came in, let's say, for back pain. But in the process of doing the full exam, we find out they can't turn their head very well to the left. we find that they have maybe 50% loss of strength in their hand. We find that maybe they don't have as much feeling in their hand as they do in the other hand. So they had no idea that these problems, because most of these problems are subtle, they're not painful, they're just loss of function. We take an x-ray and find out there's massive damage in their neck, get an MRI and find out they have significant stenosis. So in doing that, not only are we able to help what they came in for, which was the lower back, whether it was sciatica or herniated disc, but in the course of the exam, we picked up on other things that were structurally and functionally not working well. Kind of like your car, it's out of alignment. You can still drive your car out of alignment, but where you really wear the tires bald much quicker. So as a result of the full body exam, we're able to pick up on things that maybe not yet have expressed themselves. So as a result, we have a big proponent of wellness in our office. So most things in life that are not properly maintained, it doesn't matter if it's your spine, your arteries, right, your relationships, your teeth, your lawn. If you don't maintain it, it always gets a problem. The trouble is problems are usually silent. I mean, you don't feel your arteries clog. You don't feel your spine degenerate. You don't feel relationships begin to crumble, usually until it's in crisis. The crisis for the arteries is you're having the stroke. The crisis for your teeth is, you need a root canal. The crisis in the relationship, maybe a divorce. The crisis with your spine is maybe the first time you've had symptoms, you got a little sciatica or a little back pain, but when we do the exam, we find massive damage that's at the end stage. Your body never gave you a warning signal. So our job is to help you out of the crisis, get out of the pain, but more importantly is to correct the underlying problem, which we have the tools to do. But even more important than that is to return you back to proper wellness. So just like you brush your teeth every night, just like we should eat well and exercise to keep healthy arteries, we should do the same with, all four of those essentials, the most important of which is the mental impulse. I mean, you can go a few minutes without oxygen, you can go a few days without water, you can go a few weeks without food, but you can't go more than a second or two without a mental impulse. You'd be dead. So it's our jobs as doctors of chiropractic to make sure that brain and spine and nervous system are functioning at their optimal. To even go a step beyond that, we have a full department where we do brain mapping, right? So we it's called a QEEG, a quantitative EEG, where we can put, it's like a bathing cap on your head that has 21 holes in it, and sensors go in those little holes, and we literally record 21 different parts of your brain, and we're able to pick up on things like attention deficit, or if somebody's had a stroke or a car accident or dementia, and or who has chronic pain, and we're able to help correct this thing at the source, which is in the brain. So we have doctors who that's all they do all day long. We have doctors who only inject stem cells all day long. We have doctors who only help herniated discs all day long. And each is a specialist in what they do. So when you come, now, I do all the exams, but once we've determined what's the matter, then you get sent off to whatever department or departments that you need to visit to make sure that they're properly cared for. And the nice thing is if you're doing the job correctly, you can go back and do a post-exam, and you should see things improve. If it's a dietary thing, you should see the blood work dramatically improving. If it's a disc thing, you should see function and pain and reflexes and all those things improve. If it's a neuropathy, they should have less numbness and tingling and burning, but they should also have return of feeling to their feet and their hands, et cetera, et cetera. So we're very big on results. We're very big on pre and post, so we can know that we're making the difference. In addition to you feeling better, we know that you're structurally and functionally better.
Which is why you must have, I think you have people that come from all over the world to your clinic.
Oh, yeah. We have trained doctors from all 50 states, every province in Canada, and it's either 9 or 11 foreign countries. So whether Germany and Ireland and Australia and whatnot have come to study in our office and intern with us. But by the same token, half our practice comes from the Pittsburgh area, even though we're out in the country, or the other half comes from out of state or out of the country. We just had a few patients in from Ireland. We had one in from Romania. We had a couple in from Canada, a lot from Ohio and West Virginia and Maryland and up in New York. So, yeah, we take care of a lot of people with a lot of serious conditions that they're not finding results for locally. The great news is, we had one gentleman come with a back issue, and he said, well, I live 3 hours away. I can't afford a hotel, so we have a rather large parking lot. He said, can I bring my camper? So he and his wife, they're in their mid-70s. They lived in our parking lot for 3 weeks while we took care of him, and he had great results. We had another gentleman come up from Southern Virginia, so he's about 9 hours away, and he did get a hotel, and he and his wife spent about a month here, but we solved the problems that they were having that was limiting him from being able to go to work and do the things that he needed to do, and he did very, very well. So, yeah, people come from just about everywhere.
Well, they want to be out of pain. I want to flip over to migraines. You haven't talked about migraines. I do know that there's so many reasons why people have migraines. Does your method help pinpoint what their particular problem could be?
Absolutely. Actually, 70% of headaches come from the neck, come from the cervical spine. And then when we get into things like neurofeedback or biofeedback, where we can directly train the brain, our results with headaches are over 95% successful in taking care of all forms of headaches, including migraines. And because we first of all, we do the exam, we figure out what the cause or causes are, and then we're able to, because we can treat the brain, we can treat the nerves, we can treat the spine. If it's dietary, we can do all kinds of things to both address it as well as help prevent future migraines.
Wow. What do you think the myths are around being a doctor of chiropractic? Is it, it's not real medicine, or kind of, what do you say of the myths?
I would hope it's not real medicine. See, if you looked at health like a yardstick, so the first 33 inches are function. The last 3 inches are pathology. So what that means in real terms is about 4 to maybe 10% of problems have a pathology. You go to the doctor with a headache and they do a CAT scan and they find a tumor. That's a pathology, right? But that only happens a very, very small percent of the time. The rest of the time, the doctor, it's a functional problem. Something is just functionally deranged. It's just not working properly, but it's not yet reached the level of a pathology. So medicine is the treatment of pathologies and the suppression of symptoms. So if they don't find a pathology, they give you pills or they give you a shot. And that's 95% of what happens in medicine. So I would hope from that myth standpoint, what most people don't know is that myth was created on purpose. It was in I don't know the exact years, but I knew 1983 stands out in mind, maybe 1993. But what happened is the doctors of chiropractic sued the American Medical Association. And during the court, they showed that on your first day of medical school, that you were given a pamphlet, a folder that said the chiropractors were rabid dogs. And look, and let's assume in the course of my exam, I saw a mole on your back. I said, you got to go see the skin doctor and the dermatologist and let him take a look at that mole. I'm not sure what that looks like. In the 50s, 60s, and 70s, if that doctor accepted the chiropractor's referral, he could lose his hospital privileges, which is insane, right? So conversely, this went on. I mean, and they showed posters in the changing rooms in the hospital slandering doctors of chiropractic. And there were public relation campaigns. And the funny part is that your doctor of chiropractic, his education, same textbook, same university, actually has about 25% more hours of education than your family doctor, your PCP. So where they go off to study drugs, we go off and study the human body. Your family doctor, the number 2 reason for seeing a family doctor, is back pain. But your doctor has less than 4 hours of instruction their whole 8-year career on what to do about back pain. The number one reason people see doctors is respiratory infection. So what doctors do for back pain is give you pills or send you to therapy, and people begin this roulette. They after therapy, then they'll go have shots. After shots, they'll go to pain management. After pain management, they go to the surgeon, which of only 2 or 3% are surgical candidates. So 75% of people who start with chronic back pain 1 year later are still in pain and disabled, because the standard system doesn't address anything that's wrong. And so as a result, if you're sent to a medical doctor first with back pain, 42.7% of people will end up with back surgery, which is horrible. If you're sent to a doctor of chiropractic first, only 1.5% end up in surgery. So I'm glad that I chose to be a doctor of chiropractic, not a medical physician. I could have gone to medical school, but I didn't see the point of just taking pills forever. It's just that's the number one killer in our society is called iatrogenesis, right? Number 2 is heart disease. Number 3 is cancer. Now, all the medical journals list iatrogenesis, which means properly prescribed, properly taken prescription medication. They list it since the 1990s as the number 3 cause. But they always say, we only really count about 10% of them. If you counted all of them, it is by far the number 1 cause of death in our country. And that's what they learned in the course of that Supreme Court case against the AMA. They said in the end that the American Medical Association was the most reprehensible organization that judge of 32 years in the federal court had ever seen. And she said it was all for one reason and one reason only. If they were spending money in the chiropractor's office, they weren't spending it in the medical doctor's office. So that's what the slander was about. So would I want to see somebody who did the flying 7? I prefer not. But if you had to put my skill set up again, I employ multiple physicians. I have friends who are physicians. Most of the patients we see, over 99% of them, have failed all standard medical care. That's why they're here, and we get a result over 95% of the time. So I'm very proud and pleased to be a doctor of chiropractic with the advanced training that we have, as well as the advanced equipment. We brought in other brains like neurologists and medical physicians so we can all work together with the patient. And I just think it's the best of all worlds.
How long is there an average length of time? So if somebody comes in with a back pain or a neck pain or migraine, is there a certain length of time generally? You talked about the one gentleman that came and camped out in your parking lot for 3 weeks, and another one that's been in a hotel for a month. Is there an average?
Well, so it really isn't. It depends. Like the gentleman this morning was just a neurospinal alignment. His whole treatment was 15 minutes, and it was over 90% better, right? But the other gentleman, he's 400 pounds. We got all kind of other issues, right? He has massive degeneration. Disc degeneration, dried up, dying discs, bone spurs pushing on spinal cord and nerves. Whole different treatment option than somebody who just tweaked their back this morning, right? Same thing with somebody who has a little bit of arthritis in their knee versus somebody who's nearly bone on bone. So they're all fixable. It's just like your car, a little bit of rust, right? You just a little touch-up paint, for a scratch, and it's over in just 5 minutes. A little bit more rust, it's doable, but it maybe takes you an hour to prep the car and fix the rust. If it rusts all the way through, it's still fixable, but now you're into more time and more money to make that happen. So it really depends on what the cause is. Well, we have many people. We did one thing. We had out of 47 headache patients, we had 44 of them be headache-free in 1 day. So these are people who have been suffering for most of their life. One guy was 37 years. Another person was 53 years. And in 1 day, their headaches were substantially reduced or gone. So it's not uncommon. Not everybody's that way, but in that particular exercise that we did, that was the case. For chronic back pain with disc herniations, most people start to feel better in a few hours to a few days. By the end, it's maybe to fix a herniated disc may take a month or so. But once it's fixed, historically, unless you have another injury, it's fixed. And not only are you pain-free, not only can you go back to doing the things you enjoy doing, but you've avoided surgery and a lifetime of misery from having chronic nagging back pain.
A few minutes ago, you talked about PRP and stem cell. That seems to be kind of a trendy thing in the medical community. Talk more about that.
Well, first of all, the PRP was actually made famous right here in Pittsburgh by Hines Ward and Troy Polamalu of the Pittsburgh Steelers. Neither one could play. I think it was the '08. It was the year, unfortunately, we lost to the Green Bay Packers. But neither one could play in the Super Bowl, and then a week later they played. And like, what in the world did you do? And there was all kind of articles they had used, platelet-rich plasma, PRP. PRP is amazing. Now, when you get into stem cell therapy, Mayo Clinic, which is the top medical center in the world, just recently has a new regenerative medicine program. So you can go to school, be specialized for an orthopedist or a neurologist or, rheumatology. Well, now you can be a regenerative medicine specialist because it's all about PRP and it's all about stem cells. And they're doing IVs with stem cells where people who have things like scleroderma, and they're given a few weeks left to live and they're going to die. There's a great video on our website of that. The gentleman had an IV infusion of stem cells, and the next day he can move his hands. And then a few months later, he's back to fully normal, working, doing everything he was supposed to do. And we have videos on our website of University of Pittsburgh. A gentleman was a police officer, was at a party, and somebody threw gas on a fire, and it just tragically burned the whole right-hand side of his body very, very badly. And they put him in like a paint booth, and they sprayed him with stem cells. And in 4 days, it's in the video, 4 days, all those burns are gone, and his skin looks just as good as yours or mine, and there's no scarring. So stem cells are the future of medicine. And, of course, people try to use that and still try to ignore the other three essentials, right? The food, water, the oxygen, and just try to do everything through stem cells. But, look, you can regenerate cells and tissues by leading a healthier lifestyle. They just did a study on hyperbaric oxygen chambers that they actually reversed cellular damage, and the first time they showed that you reversed aging in the cells. And when you put stem cells in, you generate new tissues. So there's lots of things that transpire, and so stem cells are amazing. We heal a lot of rotator cuffs, a lot of hips, knees, thumbs, elbows, ankle, any joint in the body, a lot of knees that people are facing having a joint replacement, which is not it's an amputation. 1 in 200 with a joint replacement will get, a blood clot that could be life-threatening. We're going to have a percentage of those, 6 to 10%, get an infection that might take weeks, months, or years to be resolved. You're going to have 44% of those people still have pain of a 3 to a 5 on a daily basis. You're never able to kneel down again. So it's a big commitment. So if you're able to just do a few simple injections of stem cells or PRP, and that joint regenerates itself, and they get out of pain, and they can go back to climbing stairs and gardening and getting in and out of their car and in and out of the bathtub and on and off their tractors. It's just an amazing thing to be able to help people with.
And you've got somebody in your practice who specializes in either one of those?
Oh, absolutely, yes. We have a whole department, just for stem cells. Absolutely.
Interesting. Well, I'm looking at our time. We are out of time, but this was so fascinating. Dr. Vinton, do you want to offer anything to anybody that's listening here to this program?
Oh, yeah, so we have, for the last 32 years, we have never had a charge for an initial evaluation. The day that I turned around in that parking lot, that We Care clinic stood for where everyone can afford a routine evaluation. And so I think their evaluation was like $20 or something. So we just went a step further. There's never been a charge. It's a full evaluation. We're going to spend 30 minutes to an hour together. We're going to use everything we have available in the clinic, every test, x-rays, whatever we need to do, so we can see exactly what the problem is. And then we'll discuss with you what that is. So anybody who would like to have a free phone consultation, maybe a free Zoom meeting, or in person in the clinic is usually best because we can actually touch, see, feel, do all the things we have to do. I would encourage you. That's normally anywhere from a $200 to a $500 visit. Absolutely at no charge. No bill has ever been sent for that visit. The only thing we ask, if you make that appointment, just be courteous of others and keep that appointment. But we would be glad to offer that to anybody listening to this program.
Well, that's very generous. So how can they take advantage of that?
Just give the office a call. Our 800 number is 800-340-9535. That's 340-9535. The phones are answered live 24 hours a day, 7 days a week. And just leave your information. And actually, I will personally return your call, do a brief phone consultation, see exactly what's going on, and then find the best time for us to meet and make that happen.
Well, I've got to say thank you. This was so informative. It's going to help a lot of people. So thank you for being on the program today. This is Nina Hirschberger, and go out and make it a great day.
Thank you for listening to Megabucks Radio with Nina Hirschberger. To learn more about the resources mentioned on today's show or to listen to past episodes, visit megabucksradio.com.